Hi, my name is Jessa. I'm a family nurse practitioner student at the University of Washington. My pronouns are she, her. I'm working with a preceptor today doing assessments. Could you please tell me your pronouns and how would you like to be addressed?
I'm a he, him, and you can call me Doug.
Okay, Doug, what brings you in today?
I'm here for a physical examination.
Okay, and for the purpose of the video, is it okay to record?
Yes.
Okay. All right, so let's go ahead and move that forward. Perfect. Okay. For the purpose of this examination, is it okay to expose your abdomen?
Yes, it is.
Okay, so I'm gonna lift his gown up just below the nipple line. And the bottom just above his suprapubic line. Okay, so now I'm going to start with inspecting his abdomen for symmetry, contour, any skin lesions, scars, striae, rashes, any dilated veins or ecchymosis. So it looks like abdomen is flat and symmetrical. I'm also observing for the contour of the umbilicus for any inflammation or hernias. I'm also observing for any peristalsis or aortic pulsations or quivering. Next, I will be auscultating. Is it okay if I listen to your bowel sounds?
Yes.
Okay, so I'm gonna be using the diaphragm of my stethoscope as I listen to his bowel sounds. And I'm listening to all 4 quadrants. Bowel sounds present and normal active in all quadrants. If my patient has high blood pressure, I will listen to bruise over the aorta. Renal arteries. Iliac arteries. And femoral arteries. No bruise noted. I will also listen to the liver and spleen. And there is no venous hums or friction rubs. Next, I will percuss lightly. I'm going to be hyperextending my middle finger while I strike with my other finger. And I'm assessing of the distribution of tympani and dullness, percussing in all 9 areas. Okay, and it is tympanic to percussion all throughout. Next, I will measure the span of liver dullness at the right mid-clavicular line, percussing downward, just starting just below his breast line. Okay, and then percussing from the level of umbilicus upwards until dullness is heard. And I will be measuring the span of dullness. Okay, and that's about 10 centimeters. To assess for splenomegaly, I will percuss at the anterior axillary line. So just right here to the lowest interspace. And okay, go ahead and take a deep breath for me while I continue to percuss. In and out. Okay. And that is a negative. Okay, so continue to stay relaxed. I'm gonna have you bend your knees and then just go ahead and keep your arms on the side while I lightly palpate on all 4 quadrants, okay? So I'm gonna start with light palpation. And I am noting feeling for any pain, tenderness, or masses. And I will repeat palpation, but a little bit more deeper, okay?
Okay.
Okay. So at this point, I'm also observing my patient's face for any indication of tenderness or discomfort. Okay. And abdomen is soft without tenderness or masses. Okay. So to assess for peritonitis, I will palpate slowly in the area of tenderness. So for example, if he felt some tenderness down here, I will go ahead and palpate and release quickly. If he has any tenderness or masses, I will note location, the size and shape, consistency, pulsation, or any mobility of that mass. Okay, so now we're gonna move on to palpating the liver edge, the spleen, and the kidneys for any enlargement and tenderness. To palpate for the liver, I will be using the hooking technique. So I'm gonna ask my patient to go ahead and take a deep breath in for me, and out, and in, and out. Okay. And to palpate for the spleen, I will go ahead and have you go ahead and relax your legs down for me. Okay, I will reach over and use my left hand to press the left lower rib cage upward while using my right hand to feel for the spleen edge. Okay, go ahead and take a deep breath for me. And out. Okay, in. And out. Okay. To palpate for the kidneys, I will go ahead and palpate along the costal margin. So one hand anteriorly, another one posteriorly. Palpating for the kidney. Okay. And I will do that on the other side as well. Next one is palpating for the aortic width. I will palpate deeply on trapping the aorta, each side of the aorta. Any pain or tenderness there?
Nope.
Okay, good. Okay, moving on to special techniques. To test for CDA tenderness, I will ask my patient to go ahead and sit up for me, please. All right, so I will make, I will first percuss and make a firm strike. This is just a little light, okay? Any pain or tenderness?
Nope.
Okay. Second time is gonna be a little bit harder, okay? Any pain or tenderness?
Nope.
Okay, thank you. Go ahead and lay back down. Okay, I'm gonna put your gown up again. All right. For situs, I will be testing for shifting dullness. So my patient is laying down supine. I will percuss the border of tympani and dullness all throughout here. Okay, and then to test for fluid wave, I am tapping on one side of the abdomen, feeling for the wave to hit the opposite side hand, opposite side of my hand. Okay. Okay. All right. For possible appendicitis, there are 3 tests. The first is the Robson sign, and to elicit this, I will be palpating the left lower quadrant. Do you feel any pain on the right lower quadrant?
No.
Okay, good. Second is to elicit the psoas sign. I'm going to place my hand on his right knee, and then go ahead and lift your leg against my resistance. Any pain there?
Nope.
Okay, good. Last is the obturator sign. I'm gonna ask my patient just relax. I'm gonna assist with the right hip flexion, okay?
Okay.
All right. And then I'm going to rotate internally and then ask my patient to cough. Okay. And relax. And that's a negative for all 3 tests. Last is to assess for cholecystitis. So I'm going to assess for the Murphy sign by palpating the liver edge. Okay. And I'm going to ask my patient to take a deep breath in and out. And I'm watching for sharp pain that stops on inspiration. Okay. And that concludes our abdomen assessment. Thank you.